Good afternoon, ladies and gentlemen, and thank you for joining the PQRS GPRO reporting webinar. Ms. Jerry Henniker will now begin.
Thank you, and welcome everyone. Good afternoon. Thank you for attending today's webinar presented by the Lake Superior Quality Innovation Network. To start off, I'd like to introduce you to our speakers for today. Next slide. And our speakers today will be, first we're going to hear from Laura Sawyer. She's the Clinical Application Coordinator at MPRO. She is actively involved in the Physician Quality Reporting, or PQRS program, and has assisted providers in the development of practice-specific plans to adopt an EHR system and to achieve meaningful use. Her experiences in the healthcare field and have led her to the role as the PQRS team and have resulted in her development as a subject matter expert in the area of quality information reporting. And then we will also be joined by Marnie Anderson. She's a health IT specialist at Metastar. Ms. Anderson has forged solid working relationships with healthcare practices across Wisconsin, facilitating their understanding of government programs, including meaningful use in the physician quality reporting system. She facilitates reporting of preventive health measures through the coordination of learning and action networks, best practice sharing, and direct technical assistance to provide organizations with this information throughout Wisconsin. Since joining Metastar in 2010, she has also facilitated more than 100 HIPAA security risk assessments. And then Candy Hansen is the program manager at Stratus Health in Minnesota, and we will make sure that you hear from her at another opportunity. Next slide, please. Our agenda for today is to gain an understanding of the group practice reporting option. We're going to learn what qualifies as a group practice, what are the methods of reporting using the GPRO method. We also will learn how to understand and register the GPRO reporting in QualityNet, and what do you have to do to sign up with the Lake Superior Quality Innovation Network, or the QUIN, and then we'll have an opportunity for your questions and answers. And next slide, please. And next I'd like to talk a little bit about the Lake Superior Quality Innovation Network. The LSQIN is comprised of 3 organizations: MPRO in Michigan, Metastar in Wisconsin, and Stratus Health in Minnesota. Together, the 3 support the Centers of Medicare and Medicaid Services priorities for healthcare quality improvement in each of the organization's respective states. And with that, I'm going to turn it over to Ms. Laura Sawyer.
Thank you, Jerry. For those of you that are not familiar with this term GPRO, it stands for Group Practice Reporting Option. Group practices have the option to report PQRS as a group or a GPRO. So rather than reporting as individuals, you are reporting as a group. If you choose to report as a group, then CMS will analyze your PQRS data at the tax ID level rather than the NPI level, which the NPI level would be if you were reporting as an individual. For purposes for the PQRS program, a group practice is defined as a single tax ID with 2 or more individual eligible professionals who have reassigned their billing rights to the group's tax ID. As a reminder here, we're showing that more than just physicians can make up your group number. Your group number is also include therapists and practitioners, all listed here. In addition, all the providers listed here should be reporting PQRS either as a group or as an individual to avoid the PQRS payment adjustment. But today we're going to focus just on reporting as a group. You must have 2 or more eligible professionals billing to the same tax ID to be considered a group. Depending on your group size, there are different reporting methods available to report your PQRS data. Groups with 2 or more EPs can report via a qualified registry or using your certified EHR system. You have to be a group of 25 or more to have the option to report through the GPRO web interface. If you're unsure about your group size or you just want to verify, you might be on the edge there between 24 and 25. you want to look at the amount of NPI numbers billing to your tax ID and pay codes. Also, for each reporting method, there is the option to supplement your PQRS data with the Consumer Assessment of Healthcare Providers and Systems, known as CAPS. Groups of 100 or more must use the CAPS survey, and we'll go more into depth on each reporting method and then also the CAPS survey in the coming slides. Okay, so first let's talk about reporting through your EHR system. CMS is trying to reduce the burden on providers reporting in multiple quality programs by aligning reporting requirements for those using a certified EHR system. You can use electronic quality measures known as eCQMs to report both PQRS data and for the clinical quality measure portion of meaningful use. So satisfactory reporting your eCQMs for PQRS will also meet the clinical quality measure portion or requirements for meaningful use. And this is often referred to as the report once option. And then this can be used when you're reporting as a group or an individual. When using your EHR to report PQRS as a group, you must choose 9 eCQM measures that cover 3 domains. You must report on all eligible cases in the denominator of the measure, and you must run the PQRS report on a year's worth of data. If you're reporting through your EHR vendor may fall into one of 2 buckets, either a direct vendor or a data submission vendor. Direct EHR vendors allow the group practices to generate their PQRS report from their EHR themselves, and then the group practice would be responsible for submitting that data to CMS. On the flip side, if your vendor is an EHR data submission vendor, then they'll collect the group practice's PQRS data directly from the EHR and then submit it to CMS on behalf of the group practice. If you're unsure of what bucket your EHR falls into, talk to your vendor on what process they use to actually submit your PQRS data. All of the following requirements must be met in order for a group practice to be able to report via the EHR. First, all eligible professionals within the group must be using the same certified EHR system to report. So you can't have half on one type of vendor and then the other half using another because they won't be able to pull the same group report. Second, the final set of data submitted must be collected using a 2014 certified EHR system. But something to remember, even though you might not have a 2014 certified system for the full year, or you're not utilizing the system from the first day, it won't matter as long as you're pulling your final report using that 2014 certified system. You'll be able to report. And then finally, before you register, make sure your EHR system will be able to analyze the group's data at the tax ID level. Not all EHRs have the capability to do this, so please verify with your vendor that your system can analyze the group's data at the tax ID level. You may also report as a GPRO using a qualified registry. The criteria to report successfully using a registry is to report 9 measures that cover 3 domains. You must report on at least 50% of your Medicare population, and you will report on a year's worth of data. You want to work closely with your registry when you submit data to CMS. Also new for the 2015 reporting year is that you must report 1 cross-cutting measure when you choose the registry method of reporting. CMS defines cross-cutting measures as broadly applicable measures that many different eligible professionals can report on. They are all listed here, and then they're also available on CMS's PQRS website if you need to refer back to them. Another method of reporting is for groups to report through the GPRO web interface, and this option is only available for groups of 25 or more. The GPRO web interface is a web-based reporting tool that is pre-populated with a sample of the group's Medicare beneficiaries. So basically CMS is telling you which patients they want you to report on. There's a total of 17 individual measures included in the web interface, and these measures include measures that cover care coordination and patient safety, coronary artery disease, diabetes, heart failure, hypertension, ischemic vascular disease, mental health, and preventative care. So CMS will give you the patients that they want you to report on, and they'll also tell you which measures out of those measure categories that they want you to report on for those patients. And you must complete the measures for 248 consecutively assigned beneficiaries. If you are part of an ACO, then this is how you will be reporting your PQRS data. You are automatically enrolled to report as a group, and you'll be using the GPRO web interface. Lastly, groups of 2 to 99 may choose the Consumer Assessment of Healthcare Providers and Systems Survey, known as CAP. But this option is mandatory for groups of 100 or more. CAP for PQRS, they are patient experience surveys that measure experiences with healthcare providers and plans. The data collected on these surveys will be submitted on behalf of the group practice by the CMS survey vendor. CAP is a newer reporting option, and the group is responsible for selecting and paying a certified survey vendor to implement the CAP survey on behalf of the group's practice. Groups of 2 to 99 may choose to supplement their PQRS reporting with the CAP survey, so it's not mandatory for the smaller groups. If the group chooses to supplement their data and they're using an EHR or a registry, then rather than reporting the 9 measures covering 3 domains, they would report on 6 measures covering 2 domains. So basically the CAP survey is equal to 3 individual measures and 1 domain. This method may be beneficial for groups that have a hard time selecting 9 measures or 3 domains to report on. And if you do choose to supplement your reporting with the CAP survey, you would register to do that during your registration process. Now we'll take a minute for a poll question. Do you know already if you plan to register this year to report PQRS as a GPRO? Do you want to just take a minute to answer that? In just a minute, Gary will have the results of that poll question. Okay. It looks like the majority of you are already planning to register as a GPRO. Okay, so let's talk a little bit more about registration. If you're choosing to report as a group, you must register. And registration is completed through the online Physician Value Physician Quality Reporting System registration system, which is listed on the screen. The registration period is from April 1st to the end of this month, June 30th. So if you are planning to register, it's better to do it sooner than later. Also, groups may change or cancel their registration prior to the June 30th deadline. So if you register now and then later decide you need to change your registration, or you find out that your vendor isn't able to pull a report at the tax ID level, you do have the option to cancel, but you must do so by the end of the month. Once the practice registers to report PQRS under the GPRO option, any provider that bills to that tax ID will be included in the group, so they no longer have the option to report as an individual. So just make sure that that is something that your whole group is choosing to do. Eligible professionals need to register to report as a group every year if they choose to continue that method each year for PQRS reporting. If you choose to report as an individual, you do not need to register. You just simply need to report. And then also, again, if you're part of an ACO, you don't need to register. You're automatically enrolled to report using the web interface. During registration, the practice will need to indicate their group size, and this is broken up into groups of 2 to 24, 25 to 99, or 100 or more eligible professionals. Also, during registration, you will select your reporting method, either the GPRO web interface, a registry, or an EHR. And if you have a group practice that has 2 to 99 eligible professionals, then you can also elect to supplement your PQRS data with the CAP survey. Utilizing that CAP survey. So the first step to register is actually in IACS. It's by obtaining a PQRS role, and IACS stands for the Individual's Authorized Access to CMS Computer Services. The website to IACS is listed here at that first website. Once the PQRS role is obtained in IACS, you would use those credentials to register for your GPRO reporting in the CMS Secure Portal, which is the second website. We also have user guides available to download, and they give you directions on how to register for these roles if you're unsure how. You can also contact your state QIN, and we would be happy to walk you through that process. And then also as a side note, IACS will actually be changing on July 13th. So if you have a current IACS user account, it will actually transition to another system called the Enterprise Identity Management System. But the change will come after the GPRO registration, and it shouldn't hinder the registration process. CMS hasn't released more information about that, but as they do, we will be sure to update you on that. So once you've obtained your PQRS user role in the IACS system, you will register for GPRO reporting in the CMS Secure Portal seen on this screen. And then you can actually log in right here or there. And then that'll take you to this screen. You'll enter your IACS user and ID to actually get into the system. Next, along the top, you'll see the drop-down, the PQRS, and you will select registration from that drop-down. On this screen, you will see all the tax IDs that are associated with your IACS account. So you'll want to select the tax ID that you would want to register as a GPRO. If you later need to change your registration, this is the screen that you would do that. It'll actually say modify next to it. Then you'll enter your organization information and requester information. On this screen, you will select your group practice size, your chosen method of reporting, and then whether or not you'll be using the CAPS for PQRS survey. The last steps for registration are as follows. You'll enter your contact information and then also contact information for your technical person. You'll want to verify that all of the information you entered is correct before you submit it. And once you submit it, you'll want to save that registration ID for your records. Again, groups that register report as a group can cancel or update their registration, but have to do so by the end of the month. And then you can also call the Physician Value Help Desk to cancel your registration. Okay. Now I'm going to turn the presentation over to Marnie, and she will be going over the pros and cons of reporting as a group.
Thanks, Laura. Yeah, we decided to add this little bit of a conversation because it comes up in our conversations with everyone out in the field. And, you know, in general, CMS will say that reporting at the tax ID level is probably the best way to go because everyone who is billing under that tax ID then is satisfactorily reporting, and there's no other individual reporting to do. So there are some pros, of course, that get down to the measure level. So meeting reporting requirements may be easier if you've got a group as opposed to at an individual level. It's easier from an efficiency operational standpoint sometimes to keep track of just the group reporting versus all of the different measures at each specialty. Another great pro is what Laura mentioned before, which is the report once option. So specifically using your EHR, whether you're doing that yourself or you're using a data submission vendor to submit that EHR direct data, that covers all providers under the TIN for PQRS, and it also allows you at the point of attestation for meaningful use to click that button to say, I already reported, or I'm reporting electronically my CQMs, and then there's no hand entering of the CQM data at the individual provider level for meaningful use attestations. Now, there are also some cons, and a lot of this depends on your reporting method. Multi-specialty practices may find it challenging to select 9 measures for all their EPs. Specialties such as anesthesiology comes to mind, that there are very few, if any, measures sometimes available in a registry reporting option that will fit your practice. Therefore, they tend to only report at an individual level. So the best thing is to do a little bit of research and understand, you know, what your measure options are depending on which method you want to go with. Talk to your registry. Make sure you, as Laura mentioned, get in touch with your EHR vendor. Not all of them have been able to do reporting at the group level, so that knocks one option off for many groups. So in general, do a little bit of homework. Make sure you understand what is available, because when June 30th comes, you don't have any option to change. So I think that's all I really wanted to mention on this slide. So thanks, Laura, for letting me push that in.
Thank you, Marnie. We just want to remind you that the slides will be posted at our YouTube site. And then we also have an upcoming webinar on August 5th going over choosing PQRS measures. If you'd like to sign up with the QIN, you can contact your state representative here. Now we can open the line for questions. Then please take a moment to fill those out. Operator, would you please open the line for questions? Thank you.
Ladies and gentlemen, if you would like to ask a question, please press the number 1 key. Again, if there are any questions at this time, please press the number 1 key. And we do have a question from Mason Santo at Beaver Dam Community Center. Please go ahead.
Hi, my question is, we are considering the GPRO registry-based reporting option. Just wanted to ask, we can use multiple EMRs across the tax ID and still report GPRO option or not?
No, you can't. You have to actually use one EHR to pull that report.
Okay. Okay, thanks.
Yep.
We do have another question in queue. It comes from Lisa Hennon at Bayuna Regional Medical Center. Please go ahead.
Hi, we actually are just now eligible or required to submit PQRS data because we've transitioned to a new EHR. And that transition was effective May 1st of this year. How is that going to impact our need to submit for a calendar year?
CMS doesn't require you to be on the EHR for the entire year. You will have to pull your final data set from that EHR, and you'll still pull that report for the full year, but you'll still be able to report using your EHR.
Okay, so even though we pull it for the full year, the data will only be from 5/1, and that's going to be sufficient?
It should be. I think it depends maybe on the measures, but as long as you're entering, the patient history in there as readable data, usually when you pull the report and it collects the data, it's using the most current information. Like, so if a patient comes in 2 or 3 times a year, CMS really wants that third visit data that's pulled from the report. So you aren't penalized for pulling a report, even if your EHR has only been used from May forward. They just want that final data set to be from your 2014 certified system.
Okay, sounds good. Thank you.
Yeah.
There are no other questions in queue at this time.
If there's no other questions, can we pull up the evaluation question?
Again, ladies and gentlemen, if there are any final questions, please press the number 1 key on your telephone keypad. Oh, there is a question from Don Bandy at Grant Regional Health Center. Please go ahead.
Hi, we purchased a physician practice, and we report for meaningful use individually for their quality measures. So do I use that same report and report differently into the PQRS system for them?
Yep, so it's going to be, the PQRS reporting is different. You can align your C2Ms with your PQRS measures, but if you submit PQRS, it's not going to be during your attestation where you manually enter those PQMs. You're either going to submit your PQRS report to CMS using your IACS account, or if your vendor does it on your behalf, then they'll submit your PQRS data for you. You'll just want to talk to your vendor and ask them what their process is. But it is, they are different reports, and the way it kind of works is if you want to do the submit once, you have to align your CQMs and your PQRS using the eCQMs, and then you submit with the PQRS method, and that covers the CQM method for meaningful use. Does that make sense?
It does, actually. Unfortunately, It's starting to make sense.
Okay, good. It's all coming together.
So I have a secondary question off of that. So our physician clinic, which is a separate NPI number, it's operated under the same tax ID number as the hospital. So on the hospital side of our business, we have a multi-specialty gynecology that runs as a department of the hospital. So am I understanding for our one tax ID, I have to have one EHR system in place to report total measures for the group, or I have to do it individually?
That's correct. So if the two specialties, if they're billing to the same tax ID, and there's no other tax ID like it's
there isn't
under, then once you register for as a group, then anybody that bills to that tax ID would be part of the group. And if they're not on your EHR system and you can't pull that same report, then you wouldn't be able to use that method.
So you wouldn't be able to use GPRO, so we have to do individual measures. Gotcha.
Correct.
We have a question from Paul Kleberg at Stratus Health. Please go ahead.
Thank you. I'm at an airport, so I don't know how clear I am. But say I'm a professional who works in multiple locations and I have my own tax ID, but again, I use one EHR in one place and another EHR in another place, and the patients are different because, let's say, I'm a itinerant provider or a locum tenens. How do I do my PQRS?
You would have to report as an individual. So if you're using different EHR systems, you don't have that option to pull a group report, even if you're, I guess, are you a single practitioner billing to your tax ID?
That's the example I'm using, and I think you've answered my question. I'd be billing as an individual, and that's pull it from multiple sources.
Yeah, so if you're reporting as an individual, I would probably double check with QualityNet. But if you're reporting as an individual using an EHR, then I believe you can upload multiple reports. But I would double check that with QualityNet. But you would have to report as an individual rather than as a group.
The next question comes from Lee Gasto at Your Ehr Hospital. Please go ahead.
Yes, this is the first time we're going to be reporting, and I think we're going to be on the edge of the 25 practitioners. Is there any way to check before I register of exactly where we'll be at?
Hi, Lee. Yes, you can check in your PACOS billing system and see how many NPI numbers are actually registered to report to your tax ID. And the NPIs would be those that belong to any of the eligible professionals, including therapists and different practitioners. If you have like a credentialing department, they might be able to log you into the PACOS and show you, who is credentialed to bill to your tax ID.
Sounds good. Thanks.
Yeah.
And we have a question from Don Dandy. Please go ahead.
I was told we are looking to get rural health clinic status for our providers in our clinic that we purchased a year ago, and I was told that rural health clinics were exempt from PQRS reporting. Is that correct?
This is Laura, and I am still navigating that part of PQRS. They have always been exempt in the past, and I know they started allowing clinical access hospitals to report if they are reporting as the method 2 under your billing. And so I do believe it varies on your actual reporting method. I'm not sure. Marnie, are you on the line tonight? I think you can decide this better.
And we get this question a lot because a lot of critical access hospitals and their clinics and rural health clinics got letters in December and January for some of their providers who 2 years ago somewhere billed a non-RHC or non-F2HC claim on Medicare Part B. So that's the trigger. So it may be a very small number. We see it sometimes with emergency departments. They're not really billing as the RHC at the hospital. So it all goes back to Part B charges, and in your case, whether or not those are RHC charges or non-RHC charges. So we can't make a blanket statement that no, RHCs are not eligible or required. It's a little more nuanced than that.
So I'm sorry, I have another question.
Please, go ahead.
So when I go into my PAYCO system and I can see who have reassigned benefits to me under my provider tax ID, those are where I get my listing of how many providers, whether it be 20 or 25.
That's correct.
So when I look at that, since we are a critical access hospital, and some of our services are method 2 billing, that would be where I would want to have, I'm trying to figure out which EHR system or how I'm going to put this together. You know, I'm just trying to figure out, I've not gotten clear guidance whether critical access hospitals are excluded or exempt from PQRS or how we are looked at.
Critical access hospitals are able to report. They're not necessarily exempt, and it all just goes back to your billing and how you're billing your services. So if you find, I would first look at your PAYCO system and verify that to the list of eligible professionals that we have, and that includes the physicians, the therapists, and the practitioners, and get that count. And then I would look at how you're billing for those professionals, because then it's going to go back to your Medicare claims. Is that correct, Marty?
Yeah, it's the method 2 billing. If you're doing any method 2 billing or Part B, those both make that provider eligible. And then again, for the RHC or an F2HC, the added there is if it's a non-RHC or non-F2HC location, or charge, I should say.
And due to we have not gotten our RHC clinic certified yet, so we're not billing as an RHC at this current point in the year, and probably won't happen until September of 15. So what is the claim billing period that I'm to look at? Is it, because I know it was 2013 for penalties and 15, so is it claims billed in 2014 for 2016?
Yes, there's always a 2-year look back, so that means in 2017, this year, even though you will be RHC at the end of the year, you're still going to have all those Part B charges for them to look back to.
So I would still need to do this so I don't incur penalties?
Yes, we would encourage you to do this.
And so method 2 billing, those go on a UV, don't they? They don't go on a 1500.
Right, they're different, and that's why it's new. It's taken, from what I can understand, CMS a little bit of time to tease out those pieces of the method 2 billing to identify who's eligible. Similar to how they're now included in the Meaningful Use program.
How are ER providers looked at? They are looked at as an eligible provider?
Yep, and again, they'll look at the charges. So even though they might be doing work in the hospital, if there's a Part B charge, then they become eligible for the adjustment, is a silly way to say it, but they're eligible, and then they may be penalized if they don't report.
And what is the mandatory reporting period? Isn't it through 15? I mean, wasn't it suggested in the reporting period for mandatory is 15, isn't it?
For PQRS, it's always a calendar year.
So wasn't 14 suggested and 15 is when penalties will start happening in 16?
Yeah, some providers actually are receiving penalties now for not starting in 2013. It's dependent on the type of provider. It started with physicians, and then it'll phase in non-physician eligible providers.
So I know this is going back to, listen, I'm monopolizing the questions. Are there other questions, or can I ask another one?
We do have a couple of other questions, thank you.
Okay.
So the next question will come from Kim Garman at Reedsburg Physicians. Please go ahead.
Hi. I guess I'm confused on the group reporting because we have two EHRs. We have a clinic EHR and we have a hospital EHR. And, of course, like our CRNAs and our ER physicians are going to fall under the hospital ER, but over 50% of our providers are under the clinic EHR. And I was under the understanding that if we go ahead and submit under the clinic EHR because that's going to be our primary patient volume, that we would be able to go ahead and report via group reporting. Now, from what you're telling me, that is not the case?
Because I had this question from another office that wanted to submit, but they had some that were not using the same EHR system. So when I had submitted the question to Quality Net, they had said that you need to be, if both of those groups are billing to the same tax ID, that you would need to pull one report from one EHR and submit it. If you wanted to only submit one report from one of the EHRs and you felt like that was going to meet the standards for PQRS reporting, you could try to go that route, but not submitting both EHR reports. You may not meet the standards to avoid the payment adjustment.
So it's a toss-up. Basically, we're taking a chance if we do it this way.
Correct.
Okay. All right, thanks.
The next question comes from Lisa Hennon at Bayuna RMC. Please go ahead.
Again, this is going back to the question before about rural health clinics, just to make sure that I'm clear. So if our Part B charges are RHC, then that rural health clinic is exempt from reporting. Is that correct?
This is Marnie again. If you the part that's hard is you can't just say at a blanket level that RHCs are exempt because it's based on the provider's billing.
Right.
So if there are any, and this happens, like I'm sure you know, if there are some providers who are billing some of their services on Part B for a non-RHC, it's categorized different on that claim, then that one claim makes them eligible.
Okay. And this is new to us, so is there a resource that I can refer to so I just make sure that we do it correctly?
CMS did publish something, I think last year, because they were getting a lot of these questions from rural health clinics about weight. So there's a special FAQ that I can make available. I might be able to find it and put it in chat. Otherwise, you can email me or any of us as panelists, and we can get you that FAQ that explains this.
Okay. Thank you.
Yep.
And there are no other questions in queue. Dawn, go ahead.
Of course, I should have wrote my question down. I think when I'm looking at, work critical access regarding physical therapists, are they considered one of the eligible providers?
Yes, they are.
So then if I used their NPI number, I would have to report individually if I couldn't, like I said, I couldn't commingle because they're on two different systems. I thought they were listed as a qualified or as a provider.
The physical therapist?
Yeah, I thought they were. I was just trying to figure out because they're, like again, the physical therapist, I have two EHRs. So we discussed earlier, I would not be eligible for the GPRO reporting because my physical therapist are not on the same EHR as my physician clinic practice. And they all are under the same TIN.
Okay. Then, yes, CMS does ask that you pull, for the tax ID, one report from one EHR, so that would exclude you from the group reporting. As the other caller had mentioned, it could be a toss-up that if you felt like you could meet the criteria to pull one report from one EHR, but I think to play it safe, I would report as an individual because you will miss.
For me, I wouldn't be able to do that because physical therapists do not practice in my clinic, so I would miss that whole population. So I don't know how to me, that wouldn't be 50% of my business.
No, and for the EHR reporting, they ask you to report all patients in the denominator, so the 50% really applies to the registry reporting.
Could the operator please remind people how to get in the queue to ask the questions? We have people who wanted to be, how to do that.
Please press the number 1 key on your telephone keypad. If there are any other questions or comments in queue, please press the number 1 key. And we have a question from Tracy at the Catholic Health Initiative. Please go ahead.
Hi, thanks. I guess my question is to kind of expand on the critical access hospitals, and we're part of that, and we utilize Method 2 billing, but we did receive the letters back in December on some of our providers. My question is, what population is eligible to report? I know that Part B is what we're focusing on, but can we report to all patients regardless of the carrier and regardless of the method of reporting?
I think it really kind of depends on your method of reporting for the registry and then also the GPRO web interface. You're only reporting on your Medicare beneficiaries. For the EHR, they're saying to report on all patients that fall into the denominator. If you're reporting individually on claims, you're reporting, on your Medicare claims form. So it kind of limits you to who you're reporting on.
Okay.
It just depends on how you pull that report and what you're reporting on.
Okay. So if we were to utilize EHR reporting and or maybe a registry, we would have the ability to report to more than just Part B Medicare patients?
Yes. If you're reporting to your EHR, you would pull the report. You could pull the report on all patient population. For the registry, you're reporting on 50% of your Medicare beneficiaries, so I would, report on your Medicare beneficiaries.
Okay. Thank you.
Yeah. If you're choosing to report, if you're doing meaningful use as well, the report once option, it overlaps with the PQRS, so you would almost want to report your PQRS on all, so it qualifies you for that meaningful use PQM component.
Thank you.
Yeah.
And our next question comes from Mary at CCMA. Please go ahead.
Hi. My question kind of relates to something one of the other questions was earlier. Our ED is staffed mainly with locum physicians. Just kind of wondering if their tax ID and the hospital tax ID are both listed on the bill that is submitted. How does that work? I can't submit PQRS for a locum doctor that maybe if somebody comes in 2016, I have no idea that they're coming. Do you know what I mean? Or is my question really confusing?
I'm sorry. I think it's a little bit confusing.
We have one physician on staff that works in our ED. Otherwise, all of our ED coverage is contracted. Some company. How do I submit PQRS for those providers?
It does. It really ties back to how they are billing. A lot of times, your contracted employees, they are responsible for their own PQRS reporting.
But if the hospital tax ID is also listed on that bill that is submitted, because, the hospital gets paid, not the individual provider. When I asked this question earlier this year when we had submitted for 2015, I was told that we had to do for those providers. But I don't know how that is
right.
possible.
I mean, it all looks at the NPI tax ID combo and what it's being billed to. So if it's billing to, if they're an eligible physician and they're billing to the hospital's tax ID, I would think that the hospital would be responsible for reporting for them.
Because it lists the individual provider's NPI and the hospital tax ID. So if those two have to be tied together, able to qualify, that isn't going to work, because next week Dr. Johnson could be working here and I will not have submitted any PQRS for him because he's never been here before.
It wouldn't matter. When you pull the report, you pull it in the first quarter of the next year. So if you're reporting to your EHR, then you would still be able to pull data for that doctor.
Okay.
But yes, I would believe that you would have to report for them.
I don't know how that's going to work out, but okay. Thank you.
Again, ladies and gentlemen, if you have any questions, please press the number 1 key on your telephone keypad. Okay, we do have a question from Don at Grant Regional Health Center. Please go ahead.
I'm so sorry, I'm monopolizing the question. So, if I have to individually report for my providers, meaning all of my physical therapists, and I know how we set up for meaningful use for my providers to report on them, so do I go through the PECO's website based on their NPI to get set up as a proxy to report for them as well for PQRS, or is there information on how I set that up?
To report for them, so if you report for them for meaningful use and you're doing it individually using an EHR, you need an IX account, and that's how you're going to submit your data for those therapists to CMS. I would contact your EHR vendor because, either you report them or the vendor reports on your behalf. But if you need to report their PQRS data, then you go into IX and you have to submit or get a user role. It's the ERX Physician Quality Reporting System user role. You'll get a security official role, and then you'll have someone else be the EHR submitter role. If you need directions on how to get those, I can send you user guides. My email is on the sheet. But my first step, I would say contact your EHR vendor and see what their process is, because if they're submitting on your behalf, you don't necessarily need to get those user roles.
No, they're not. We submit on our behalf. They do not submit for us. So I have those user roles. We submit for meaningful use anyway. For the hospital, we have an IX account, and I do for the hospital-wide measures report for our tax ID. So if I'm going to have to report PQRS for my physical therapist, my CRNAs, I'm going to have to do by provider and by their NPI or their, PTANs, set them up so that I can do this for them, which I have not done.
So you don't have to set it up by NPI number. Your IX account is just, again, tied to the tax ID, and then you would just upload each doctor's individual report.
Do you have contact information so I can just work with you directly on if I have questions on this?
Yep. My name's Laura Sawyer. I'm here in Michigan, and then I have the screen up right now in WebEx, but my email is lsawyer@mpro.org. That's MPRO.
Are there any more questions in the queue?
No, ma'am. There are no other questions in queue.
it looks like we're heading towards the top of the hour. I just wanted to check with Laura and Marty to make sure if we had anything that they wanted to add before we wrap up for the day. And if not, I wanted to again thank everyone for joining us today for the PQRS Group Practice Reporting webinar. As Laura and Marty both mentioned earlier, the slides will be available on your LSQIN YouTube page within the next week. Hopefully everybody has had a chance to answer the evaluation questions that were posted in the chat. We hope that you did take that time because this information really does help us in planning other webinars. And with that, we'll sign off for the day, and thank you everyone for joining.